begin with, Medicare was, as I say in my article, Medicare was something of a compromise. I mean, the people that were behind it had wanted to do total universal health care for decades. It started, there'd been a movement on for a while before FDR was the first one that sort of tried to get it passed as part of Social Security. Politically, that wasn't possible, and so it was kind of put on the back burner for the time being. Truman made a speech about it, and Democrats kept introducing legislation in Congress every session to bring it about. Eventually, they realized that the people just weren't going to go for it. I mean, it was a clearly socialistic plan if you're going to put everybody under a government-run healthcare system or health insurance. And that was a little too much. But people, had become accustomed to targeted things like Social Security and other sorts of programs that seemed to be aimed at needy people. Of course, there were lies about that, too, when Social Security was put in. But in any case, Americans were kind of accustomed to targeting certain groups of people. So they were willing to accept, perhaps, Medicare aimed at just the elderly, because the elderly were portrayed as poor and unable to pay for their own health care, which wasn't really the case. As has always been the case, or generally been the case, the elderly have saved up over time. They may not be working anymore, but they have a lot of money saved up, and they have investments and other things. So they weren't unable to pay for their health care. In fact, there were existing programs that were put in place partly as a means of staving off Medicare, and as usual, these half measures don't do the job, that we end up with the full-blown thing anyway. That would also have covered any seniors who needed help, and many doctors at the time would help them also for free if they couldn't pay for it. So along comes Medicare in 1965. Finally, the time is right, because in 64, the Democrats have a big landslide victory. They take a lot of seats in Congress. You've got Johnson as president. He's got a lot of public backing because he's following up on JFK, who was assassinated, and so now's the time. But even there, if you start looking at how much this is going to cost and what's actually going to be covered, you realize that the public isn't going to buy it. So a lot of what they did was not do very much in public. Many of the hearings took place in private. Very little made it into the press as to what was actually in the bill. So you had to pass the bill in order to find out what was in it, same as Obamacare. But even then, there were things like calling taxes contributions toward a trust fund, and including future tax increases in the bill to conceal costs. And the estimate of the program, House Ways and Means Committee at the time said by 1990 that program is going to cost us $12 billion a year. Well, when 1990 rolled around, it was $107 billion, which was not even close. In fact, costs had been high from the very beginning. So that's kind of how we ended up with Medicare. And then just to say another thing too, as I said, the public didn't really know what was in the bill. They were being told that the bill was there to help in the case of catastrophic illness, but the bill didn't actually do that. That's kind of how we got where we are.